Hello and welcome to UMCC Medical Consultant Connectors. I want to start by saying something that is incredibly important. Your health is paramount. Possessing accurate medical information is a form of power. Today, we are tackling a subject often shrouded in fear and misinformation. It demands our clear-eyed attention. We are going to talk about septic abortion. This is not a topic to be whispered about. It is a critical medical emergency. Understanding septic abortion is not about inducing fear. It is about recognizing a life-threatening situation and acting decisively. In obstetrics and gynecology, timing is everything. Swift action can be the difference between a full recovery and a tragic outcome. This conversation is for anyone who has a uterus, anyone who knows someone with a uterus, anyone who believes in evidence-based medicine to save lives. We will give you a clear, calm, factual roadmap so you can act when it matters most. Let's get straight to the point and define our terms with medical precision. A septic abortion is a severe infection of the uterus and its contents after termination of pregnancy. That termination may be spontaneous, a miscarriage, or induced. Septic refers to sepsis, a life-threatening response where infection damages tissues and organs. The urgency cannot be overstated. When bacteria spread from the uterus into the bloodstream, emergencies unfold fast. Retained pregnancy tissue or blood provides a breeding ground for bacteria. Pathogens invade the uterine wall, endometritis. In severe cases, bacteremia can progress rapidly to sepsis. Primary causes: 1. Unsafe or clandestine abortion. 2. Incomplete miscarriage or abortion. Untrained providers, unhygienic environments, and non-sterile instruments increase risk. Retained tissue allows bacteria to multiply. Infections are often polymicrobial. E. coli, streptococcus, staphylococcus, and anaerobes like Clostridium perfringens. Unsafe objects can introduce C. perfringens, causing uterine gas gangrene. Modern legal care by trained professionals in sterile settings has very low complication rates. Knowing the signs and symptoms is potentially life-saving. They may start subtly, but can escalate quickly. Fever is common, over 38 degrees or 100.4 degree wands, often with chills and shaking. Severe lower abdominal or pelvic pain and tenderness. Pain more intense than typical cramps, sometimes constant. Be alert for foul or unusual vaginal discharge. Abnormal bleeding, especially soaking more than 1 pad an hour or bleeding that restarts. Systemic symptoms: rapid heart rate, low blood pressure with dizziness or fainting, feeling very unwell or confused. After a recent miscarriage or abortion, this cluster is a medical emergency. Seek immediate evaluation. Doctors take a detailed history. Timing of pregnancy loss and symptom onset. Physical exam and vital signs: temperature, heart rate, blood pressure. Pelvic exam checks uterine and cervical motion tenderness, discharge, and uterine size firmness. Key tests: CBC for high white count, blood cultures to identify bacteria, pregnancy test confirmation, pelvic ultrasound to detect retained tissue or abscess. Swabs may culture bacteria directly to guide therapy. Treatment is aggressive, immediate, and hospital-based. This cannot be managed at home. Cornerstone: broad-spectrum intravenous antibiotics covering likely bacteria, given into a vein to rapidly reach effective systemic levels. When culture results return, antibiotics are tailored to the identified organism ease. Prompt removal of infected or retained tissue is essential, usually via suction D&C. Gently open the cervix and empty the uterus. Removes retained tissue, clots, and pus to stop the source. Sometimes a sharp curette ensures the lining is clear. Supportive care: IV fluids for dehydration and blood pressure. Pain control for severe cramping. Heavy bleeding may require transfusion. Close monitoring: ICU if septic shock or organ dysfunction. After improvement, transition to oral antibiotics at home. Finish the entire prescription, even if you feel better. Prevention is the ultimate goal. Ensure access to safe, legal, professional abortion services. Worldwide, most septic abortions stem from unsafe procedures by untrained individuals in unhygienic conditions. With licensed professionals, sterile instruments, and evidence-based protocols, risk plummets. For miscarriage, prompt evaluation and ultrasound determine completeness. If retained tissue is present, discuss management, including uterine evacuation to prevent infection. Be proactive if something feels wrong. Follow post-procedure instructions. Avoid tampons, douching, and sexual intercourse for the advised period. This allows the cervix to close and the uterus to heal, reducing infection pathways. Maintain sexual health with regular STI testing and treatment. Comprehensive contraception reduces unintended pregnancies and complications. If you have high fever with abdominal pain, foul discharge, or heavy bleeding after pregnancy loss, go to the nearest emergency room immediately. Do not delay. Thank you for taking the time to learn with us today. Please empower others by clicking like, clicking subscribe, and clicking share. Your health is worth it.